Welcome to the Comfort Home Health Agency training video. Today, we're focusing on the critical role that communication plays in our daily interactions with patients. It's not just about exchanging information, it's about understanding and being understood. It can often feel like deciphering an intricate code, especially when the stakes are high and time is of the essence. The obstacles that hinder effective communication are known as communication barriers. Understanding these barriers is not just an intellectual exercise. It's a real-world challenge that we as healthcare professionals encounter every day. It's vital to address these barriers as they can directly impact our patients' outcomes and satisfaction. It's about ensuring that each patient receives the best possible care. Communication barriers are not a universal concept. They exist in various forms. For instance, physical and environmental barriers could be present due to noise, distance, or poor infrastructural facilities. A classic example of this could be a noisy hospital ward where confidential conversations are difficult. In such scenarios, using quiet rooms or simply moving closer to the patient can be beneficial solutions. Next, we have physical or biological barriers, such as hearing impairments or speech difficulties. Consider a patient who cannot hear. In these instances, employing sign language interpreters or using technology like hearing aids can be a lifesaver. Language barriers are common too. Imagine trying to communicate with a patient who doesn't speak or understand your language. Here, employing certified medical interpreters can bridge this gap. Personal barriers, which involve individual characteristics like age, education, and socioeconomic status, can also be a hurdle. For example, an older patient might struggle with medical jargon, thus patient education and the use of plain language can be effective. Emotional barriers, such as fear or stress, are common. Patients who are fearful of medical procedures might withhold vital information. In such situations, building trust and providing emotional support can make a huge difference. Socio-psychological barriers involve biases or stereotypes. A patient might feel they are being judged on their lifestyle choices. These barriers can be overcome by promoting empathy and understanding. Cultural barriers like misunderstandings due to cultural health beliefs can be a significant issue. For instance, a patient might refuse a certain treatment due to their cultural beliefs. Here, incorporating cultural competency training can be a solution. Then we have channel flow barriers, which are about the mode of communication. An example of this would be a patient with visual impairment struggling to read written instructions. In such cases, instructions can be the better alternative. Lastly, technological barriers can occur when patients or caregivers are not comfortable with digital tools. An elderly patient may struggle with telehealth visits. To solve this, providing training and user-friendly technology can make a world of difference. While we've discussed several barriers, there might be other challenges that we haven't touched upon here. The key is to be able to identify them and find resourceful solutions. For instance, let's consider the barrier of language. At Comfort Home Health Agency, our caregiver Maria faced difficulty in communicating with Mr. Wang, a patient who only spoke Mandarin. Maria used translation apps and even learned some basic Mandarin phrases, thereby overcoming the language barrier and providing effective care. Likewise, talking about the barrier of nonverbal communication, our nurse Peter had a patient who could not express his needs verbally. Peter overcame this by learning sign language and using visual aids, further establishing an effective communication stream. Another type of barrier we often face is the emotional or psychological barrier. For example, our patient Mrs. had a fear of being a burden to her family and hence avoided communicating her needs. Our caregiver Alice was able to develop a trusting relationship with her through constant reassurance and empathy, enabling Mrs. Jones to express herself better. In conclusion, communication barriers in home healthcare are real, but so are the solutions. Good communication is not about talking, it's about ensuring the message is understood. And that could mean difference between a comfortable recovery and a stressful one. Always remember, no barrier is too great to overcome with the right strategies. Welcome to Comfort Home Health Agency, where we strive to provide the best care for our patients by overcoming communication challenges with innovative strategies.